Hi people, we're going to be talking on different test procedure for your blood glucose level measurement, which includes your fasting blood sugar, your random blood sugar, your 2 hours post-Friday, your oral glucose tolerance test, and your HbA1c. To you that are just seeing this video for the first time, please click on the subscribe button, click on the bell icon to get notified each time we come online. To my returning subscribers, you're wonderful. We wouldn't have reached there without you. Thank you for being there. Let's dive into the business of this today. So for your fasting blood sugar levels, there are values that are considered critical. For an adult male, any value less than 50 or above 400 mg per day is considered a critical value. For an adult female, any value less than 40 and above 400 mg per day is considered a critical value. For an infant, any value less than 40 mg per day. And for a newborn, any value less than 30 and above 300 mg per day are considered critical. So what is the indication of this test? This test is used for direct measurements of the blood glucose level. It is the most commonest used in evaluation of diabetic patients. Through elaborate feedback mechanism, glucose levels are controlled by insulin and glucagon. Glucose levels are low in fasting states. In response, glucagon, which is made in the alpha cells of the pancreas islet of Langerhans, is secreted. Glucagon then breaks glycogen down to glucose in the liver and glucose level rises. If the fasting persists, proteins and fatty acids are also broken down under glucagon stimulation and glucose level continue to rise. Glucose levels are elevated after eating. Insulin, which is made in the beta cells of the pancreatic islet of Langerhans, is then secreted. Insulin attaches to insulin receptors in the muscles and in the liver and fatty cells, where it drives glucose into target cells to be metabolized to glycogen, amino acids, and fatty acids. Blood glucose level then diminishes. There are other hormones that can affect glucose metabolism, which includes your epinephrine, your tyrosine, and your ACTH. The serum glucose test or plasma glucose test is helpful in diagnosing many metabolic disorders. Serum glucose levels or plasma glucose level must be evaluated according to the time of the day they are performed. For instance, a glucose level of 135 may be abnormal for a fasting patient and may also be within the normal for a patient who had a meal 1 hour ago. In general, true glucose elevation indicates diabetes mellitus. However, there are many other possible causes of both hyperglycemia and hypoglycemia. If diabetes is suspected based on elevated fasting blood levels, a glycosylated hemoglobin or glucose tolerance test, which will also be discussed here, should be performed. What are the interfering factors? Interfering factors may include many forms of stress, which could be as a result of trauma, infection, burns, or cardiac infraction can also cause increased levels. Caffeine may also cause increased levels. Most IV infusion which contain dextrose, which will quickly be converted to glucose, can cause increased levels. Many pregnant women experience some degree of glucose intolerance, and if this is significant, it is called gestational diabetes. Procedure and patient care. For fasting blood sugar determination, the patient must fast for at least 8 hours. Water is permitted. To prevent starvation, which may artificially raise the glucose level, the patient should not fast longer than 16 hours. Not like when most people come to the lab, they will tell us, oh, I'm not eating since morning. And they're coming late, they're coming by 12 p.m. and they're telling you they've not eaten since morning, that's starvation. So we advise you not to fast more than 16 hours before coming for sample collection. Now, we also advise you to withhold any insulin or oral hypoglycemic agents which you're using until after blood is taken. So, what can cause increased levels, which is hyperglycemia, diabetes mellitus, acute stress response, Cushing syndrome, chronic renal failure, acute pancreatitis, and acromegaly. All these things can cause an increase blood glucose level. What can cause decreased levels, which is hypoglycemia, hyperthyroidism, hyperpituitarism, Anderson disease, extensive liver disease, insulin overdose, and starvation. All these mentioned factors can cause decreased blood sugar levels. So we're going to enter into the second one, that is at 2 hours postprandial. So this is used in the measurement of the amount of glucose in the patient's blood 2 hours after a meal is ingested. It is used to diagnose diabetes mellitus. For this test, a meal acts as a glucose challenge to the body metabolism. Insulin is normally secreted immediately after a meal in response to elevated blood glucose level, causing the level to return to the pre-meal range within 2 hours. In patients with diabetes, the glucose level usually is still elevated 2 hours after the meal. This procedure is an easily performed one. If the results are more than or greater than 140 mg per day or less than 200 mg per day, a glucose tolerance test or a HbA1c may be performed. What can interfere this test? Smoking during the test period may increase the blood glucose level. Stress, not like after taking your meal and we are timing at 2 hours, you'll be walking up and down. This can give us a false increase, a pseudo hyperglycemia value. So what are the procedure? Usually, once the patient comes, you've already informed the patient that she or he is going to come with a meal which could be high, like 75 grams of carbohydrate. You've already told the patient that she's going to fast 2 hours prior to this test. So immediately the patient enters, the first thing to be done is a fasting blood sugar sample is collected. Then the patient is required to fast 2 hours prior to this test and should also eat the entire meal with at least 75 grams of carbohydrates and not to eat anything until the blood is drawn after 2 hours. Not like some people will stay small and they'll come and ask you, "Ma, can we still eat anything? Can we drink water?" You will not drink water. You will not eat anything until we take a sample for 2 hours. So patients should also rest during this period. We don't want you to be walking up and down, as stress or exercise can increase the glucose level. We are going to enter to glucose tolerance. It could be called glucose tolerance or oral glucose tolerance test. This test is used to assist in the diagnosis of diabetes. It is also used in evaluation of patients with hypoglycemia. The NDDG has defined criteria sufficient for diagnosing diabetes mellitus, and these include sufficient clinical symptoms, which includes polydipsia, polyuria, ketonuria, and weight loss, plus unequivocal elevation in fasting blood sugar or a non-fasting blood sugar of greater than 200 mg per day. Number 2 criteria includes elevated fasting blood sugar of greater than 140 mg per day on more than one occasion. 3 includes a normal fasting blood sugar but a glucose tolerance peak and 2 hours value greater than 200 mg per day per 100 ml in more than one occasion. The glucose tolerance test is then used when diabetes is suspected, but the criteria for the diagnosis cannot be met without getting data by the glucose tolerance test. The glucose tolerance test is also suggested for the following patients. Number 1, patient with family history of diabetes. Number 2, patient who are massively obese. 3, patient with history of recurrent infection. 4, patient with delayed healing of wound, especially in the lower legs and feet. 5, women with history of stillbirth or delivering large babies. 6, patients who have transient glycosuria or hyperglycemia during pregnancy or following a myocardial infarction, surgery or stress. In the glucose tolerance test, the patient's ability to tolerate a standard oral glucose load is evaluated by obtaining plasma and urine specimen for glucose level determination before glucose administration, and then at 30 minutes, at 1 hour, at 2 hours, at 3 hours, most times at 4 hours. Normally, there is a rapid insulin response to the injection of a large oral glucose load. This response peaks at 30 to 60 minutes and returns to normal in about 3 hours. Patients with appropriate insulin response are able to tolerate the dose quite easily with only a minimal and transient rise in plasma glucose levels within 1 or 2 hours or 1 to 2 hours after injection. Glucose will not spill over into the urine in normal patients. Patients with diabetes will not be able to tolerate this load. As a result, their plasma glucose level will be greatly elevated from 1 to 5 hours, and glucose can be detected in their urine. Gestational diabetes can also be detected by the glucose tolerance test. Generally, the diagnosis can be made if 2 or more of the results exceed the following: at fasting, 105 mg per dl, at 1 hour, 190 mg per dl, at 2 hours, 165 mg per dl, at 3 hours, 145 mg per dl. Educate the patient on the need to be having adequate food intake with adequate carbohydrate for at least 3 days prior to the test. Not like when they will come, when you give them the glucose load, they will tell you that I'm very hungry, I don't think I can wait for the 2 hours. So you have to educate the patient that he or she must feed very well 3 days prior to the test. Instruct patient to fast 12 hours before the test. Also instruct patients to discontinue drugs, which includes tobacco. It could give us a false positive result. Once the patient comes, obtain the fasting blood sugar sample and urine specimen. That's at fasting. Then administer the oral glucose solution. Give for pediatric patient, you can calculate it. You can give them a load of 1.75 gram per kg body weight. Instruct the patient to ingest the entire glucose level. Also instruct the patient not to eat anything until the test is completed. Collect urine specimens at hourly intervention. Mark the appropriate time that each samples we are taking from these patients. So after that, we send the sample to the lab for analysis. The lab scientists will run the samples and plot a curve for the doctor. Now we're going over to glycosylated hemoglobin. This test is used to monitor diabetes mellitus. It measures the amount of HbA1c in the blood. This test provides an accurate long-term index of the patient's average blood glucose level. In adults, about 98% of the hemoglobin in the red blood cell is hemoglobin A. About 70% of hemoglobin A consists of a type of hemoglobin, HbA1, which can combine strongly with glucose in a process known as glycosylation. And once glycosylation occurs, it is not easily reversible. HbA1 is actually made up of 3 other components, which include HbA1a, HbA1b, and HbA1c. And HbA1c is the most component that is the most strongest combined component. HbA1c makes up the majority of the HbA1. About 70% of HbA1c is glycosylated. Only 20% of HbA1a and HbA1b are glycosylated. Therefore, HbA1c is the most accurate measurement. HbA1c is fast becoming the most common component measured. As RBC, as red blood cells circulate, it combines with HbA1 with some glucose in the bloodstream to form glycohemoglobin. The amount of glycohemoglobin depends on the amount of glucose available in the bloodstream over the red blood cells 120-day lifespan. Therefore, the determination of the glycohemoglobin value reflects the average blood sugar level for the 100 to 120 days period before the test. The more glucose the RBC is exposed to, the greater the glycohemoglobin percentage. One important advantage of this test is that the sample can be drawn at any time because it is not affected by short-term variations, e.g. food intake, exercise, stress, hypoglycemic agents, patient cooperation. It is also possible for a very high short-term blood glucose level to cause an elevation of glycohemoglobin. Usually, the degree of glucose elevation results not from transient high level, but from a persistent moderate elevation over the entire life of red blood cells. This test is important for the following. Number 1, in evaluating the sources of diabetic treatment and patient compliance. Number 2, comparing and contrasting the sources of past and new forms of diabetic therapy. Number 3, determining the duration of hyperglycemia in patients with newly diagnosed diabetes. Number 4, providing a sensitive estimate of glucose imbalance in patients with mild diabetes. Number 5, evaluating diabetic patients whose glucose level changes from day to day. And lastly, differentiating short-term hyperglycemia in non-diabetic. What can cause increased levels? Newly diagnosed diabetic patients, poorly controlled diabetes, non-diabetic hypoglycemia, e.g. increased acute stress response, and so on. Pregnancy can also cause a high value. What can cause decreased levels? The decreased levels can be caused by hemolytic anemia, chronic renal failure. Thanks for watching to this end. If you've really watched to this end, you did a great job. Please, if you've not subscribed to our video, please subscribe. Please click on the bell icon to get notified each time we come online. Thank you and bye.